want to talk about safe care, just from a global perspective, what we're doing. The linking factor amongst all the different speakers here today was digital. Interestingly, digital plays a fantastic role in reducing the cost, admin cost, showing transparency, and also letting you see the outcomes of what you're doing. Because without any kind of technology, you can't measure the input of what the efforts you're putting in place. So it's important that you have some kind of technology base, which is light, not very expensive. We have the tendency to build humongous systems, but these are really simple technologies that we can deploy. You can see the SafeCare tool is now a digital, it's on Android, it's on Google Play. Actually, it's called the Quality Improvement Tool. But of course, you have to come through us to be able to access it. So I just want to talk about what we are doing. But first, just to give you a holistic picture of PharmAccess and where we are and why we do what we do. As you can see, we're in 4 African countries. We started out on the demand side, that is empowering people to go into the facilities. But very quickly, you realize that you have to make sure that the quality of care that they get within these facilities is good enough. Okay, so there's no point empowering people and they get into the facilities and the quality of care is not good. So our intervention is both on the supply side and on the demand side. The demand side with insurance, we support quite a number of states, and I must recognize some of the states that are here: Adamawa State, Delta State, Lagos State, and quite a few others in the north through other projects. So as we do that, because a lot of our interventions are new, we try to do impact evaluations or some kind of research around the methodology, which is why we have research there. Then, of course, the mobile technology, digital technology, trying to improve our processes using digital. So, as some of you may have heard, I don't know how many of you have heard the new phrase, UHC 2030. How many have heard UHC 2030? Not a lot of people, but that is the new movement. All 193 nations came together in New York in 2015 and made a resolution to achieve universal health coverage by 2030. I know we keep moving the goalposts, but hopefully we can achieve this. And that includes us. Now, whether we like it or not, UHC is dependent on quality, the quality of care that is given within the healthcare facilities. Because if people are not going into the facilities, then what are we trying to accomplish? And again, this feeds back into the SDGs. The 17 SDGs, of which SDG 3 and 8 are very paramount to our work in the healthcare sector. So, as I said, quality is the focal point. We have to ensure that the quality of care that is given within the facilities, whether the person can access care, and when they're able to access care, that the quality is good, and there's a way to benchmark it. So that leads us into how we improve quality. We try to be very innovative, but at the same time, we try to be very, very practical. Safe care is, it was developed from the bigger standards developed by JC and COSASA, which is pass or fail. You either pass or you fail. But we realized very quickly that, we're too far below right now to be passing or failing anybody. What we need to do is encourage facilities to improve their quality. So we look at the solutions. We look at practical, ways of solving problems. Say, for example, we go to a facility, there's no running water, and we talk about hand, cleanliness and washing your hands. Can you put a bucket with a tap and, devise a way locally that fits the local content to have clean hands? So these are some of the things that we work with. We try to prioritize. What are the priority areas? We don't go into all the different disease profiles. We don't go into all types of, interventions, but we try to prioritize and then start from those. So maternal and child health, tuberculosis, HIV, and so on and so forth, as well as broad base in terms of system strengthening. So that is really, then again, we try to make sure that, the standards are digital. So before, it would take our assessors maybe 5 hours to record, ask questions, document, then go back and put in the details into the database. But now it's on a tablet, it's on a phone, Android phone, and you can put in, the results right away. And it gives you the quality improvement plans, because really when you do an assessment, which is what we do, we try to find gaps. And these are practical solutions and practical questions that they can answer. Is it there? Is it not there? If it's there, is it functional? And so on and so forth. So that way, we can help the facility move along the quality improvement pathway. Again, what we also try to do is to work with each of the facilities. So we don't give you a quality improvement plan and then we leave you to figure it out yourself. We try to work with you. We call it mentored assessment. Again, this is some of what we do to make sure that quality improves within the facilities. Then in terms of, some of the products that we have, when I say products, we are continuously thinking of new ways either to educate, new ways to improve the quality, new ways to extend what we've done so far. So we now have this Safe Care Steps, which is a licensing model. So we are currently, within PharmAccess, we are staff of maybe 28 professional staff, but we are all over the country. How do we do that? We work with partners. We work with other consultants, entities that can license our model and use it. With the state government, like we're working with Lagos State government, who has adopted our Safe Care standards, Adamawa State. And also to mention that as part of our other lines of business, the Medical Credit Fund, where we give loans to healthcare SMEs to improve their quality, Safe Care quality improvement process is embedded within that, because we know that if you provide good quality care, the likelihood of us getting our money back is increased. Then we have a Safe Care quality platform, which is, again, a knowledge-sharing platform for education and so on and so forth. Then the last is Safe Care accreditation. We felt that in the past, what we've done is really, maybe I'll call it certification, because we are really haven't been accrediting any facilities. What we've been doing is working with you and giving you some kind of certification when you reach a certain level. So Safe Care has 5 levels, level 1 through 5, 1 being the lowest and 5 being the highest, which Dr. Nya has reached. So at each attainment of a new level, you're kind of awarded a certification just as an incentive to continue improving. But what this has also shown, in the case of Lagos, what we are doing is working with them to see how we can tie the Safe Care levels to the enrollee empanelment, because there has to be some kind of reward to continue to improve quality. So for example, your Safe Care level 1, when the health insurance scheme kicks off, your enrollee base is capped. So you could have, just as an example, you could have about 500 enrollees. But if you move up to level 4, you could have up to 20,000, because you have the processes and qualities in place to be able to, take care of those patients. And again, what this links to is that the higher the number of enrollees you have, the more capitation you receive in the health insurance program, making it easier for you to either expand your facility or improve or, extend the care you're giving to new patients. Then again, this is just the platform, just to mention some of the things that we do and we share in terms of a database information that is going to be open to the public to go and look at. If you want to develop an SOP, is there an example online that I can modify and adopt and all that? So this is going to be developed and we will make it open to the market. Then Safe Care Gold I talked about. This is going to be an accreditation. So for those that have reached a certain level of quality improvement, they will be given a stamp, they will be accredited. And this is yet to be launched, because we felt there's a need to recognize those that are striving to improve quality and extend other benefits to them, maybe cheaper loans, maybe the first right of refusal for a donor coming in looking for a partner. So there are other benefits that will be tied to providers reaching this level of quality. Then we haven't left the pharmacy line or business out of our sights, because we realize that if you go into the hospital, no matter how good the physician is, your survival depends on the quality of the medication. So we are slowly going into looking at pharmacy tools, pharmacy accreditation. But this, we started with a self-assessment tool. With our work with PCN, we realized that, it is a huge market that has the potential to, improve the quality of care within Nigeria. Some of you may not know, there are over 900,000 patent medicine vendors. There are about 35,000 community pharmacists. So you see that these patent medicine vendors are the ones that go set up in the rural areas. They are the ones that are providing care to your relatives in the village, and they are not qualified to do that. They don't even have the educational background to do that. So what we're trying to do is to bring them under regulation of PCN and have some kind of hub and spoke model where community pharmacies are overseeing what they are doing. But first of all, to do that, you have to find out where they are. In Kaduna, for example, we were given a list of about 600 patent medicine vendor lists to identify and, find out their level of education. By the time we were done, we had found over 4,000. So even the regulator doesn't even know that these people exist. In the course of it, our staff were beaten up because they thought they were tax collection agents and all sorts of things. So, I have to say really that there's a lot of work to be done. And it takes team effort. It takes partners working together. It takes, people thinking out of the box. It takes all sorts of collaboration to make this kind of things happen. And I'm proud to say that, we, as PharmAccess, we are not closed. We're doing this project with SFH and so many other projects that we're doing along with several other partners, because the market is big. The problems are huge. So you have to take it one bite at a time, with different people coming from different angles with different solutions. And maybe at some point we'll all meet in the middle, but it's important that we all collaborate. So just to talk about some of our impact, we have over 2,300 facilities, active safe care facilities. And with that, you can get a lot of data in terms of processes and how things are improving and allowing us to continue to improve the standards. And of course, within these facilities, you can imagine the impact on patients. Over 3 million patients, because again, we continue to monitor and get feedback also from the patients. And the number of assessments done, over 4,000. Assessments is going to actually look at the facilities and what they have in place. This is just testimonials. Some of the hospitals that we work with, I don't know whether, for those who don't know Subol Hospital was one of the first hospitals we also started working with when the community health insurance scheme was rolled out many, many years ago. But he was a really small hospital. He situated himself in the middle of Alimosho local government area, if people know where that is, right in the heart of Lagos State. Right now, if you go to his clinic, he has expanded, he has built an extension. You go to his clinic, you will not even see space. The quality of care that he gives based on mentoring, he's now safe care level 4. There's so many people coming to look at his clinic to find out what is his, modus operandi, what is he doing that is so good. The Queen of the Netherlands has been there. Peter Sands, the director of Global Fund, has been there. In fact, next week, I have the liberty to take Merck from others, MSD, to go and look at the clinic. But these are some of the examples that need to be highlighted. So that's just to give him some credit for the work that he's done. And again, to say thank you for inviting me. And I hope we can get some traction and change the narrative for Nigeria.